If you are already tried the stretching, maybe even bite splints, but your masseter muscle is still painful, the problem is probably not that you are doing too little. It's more likely that you are doing things in a wrong order or targeting the wrong structures. In this video, we are going to build clear framework. First, we will going to look what actually overloads the chewing muscles. Then we will going to talk about splints and Botox and what do they really do. And finally, I will going to show you very precise self-care techniques for both for the superficial and the deep part of the masseter muscle. And quick note before we begin. If your jaw locks, if there has been trauma on the background, or if the pain suddenly becomes much worse, it's important to seek evaluation from the healthcare professionals. What overloads the chewing muscles? Let's start by understanding what actually loads the chewing muscles and why they can be sometimes constantly active. One major factor is stress. During the night, the central nervous system may enter to fight or flight state. When that happens, the signals travel through the peripheral nervous system and activate structures that tell chewing muscles to contract. And as a result, your teeth may be clenching together strongly during the sleep. If you are interested from this topic, I've linked another video about this in the description, but you can find it also from the card above. Another situation happens during the daily activities what demands a lot of from your brain. You may suddenly notice that you are clenching your teeth without even realizing it. Another contributing factor can be constant tension in the upper neck. When the jaw moves forward, the chewing muscles automatically becomes more active. That forward head posture can also contribute to the headaches, and overall it's not that comfortable position for your body. If you like to see very effective exercise for the muscles, what counteracts this posture, write neck exercises in the comments below and I will going to make sure that I will going to make video about it. And next, what do bite splints actually do? Some people may think that the bite splints stops cleansing completely, but their main purpose is actually to protect your teeth. The teeth what you have are the best ones you will ever going to get, so protecting them is extremely important. However, if your splints make your pain worse, it may require adjustments. Your bite may have changed slightly or your muscle may simply do too much work during the nights. How we can calm the nervous system? If the body is already in stressed state, if you are constantly clenching your teeth or you feel that your body is always tense, the first goal is to calm the nervous system. The easiest place is to start with the relaxed jaw position and how to relax your jaw. Find comfortable position. Place the tip of your tongue just behind your upper front teeth and let the whole tongue rest gently against the roof of the mouth. Breathe through your nose. Leave the small gap between your teeth just few millimeters, so the chewing muscles are not that active. Your lips should lightly touch each other's. Now try gently shaking your head quickly. Your jaw should remain relaxed and you might even feel the slight vibration or flapping sensation in your mouth. That is a good sign that your jaw is relaxed. Understanding the anatomy of the masseter muscles. To treat this muscle properly, you need to understand one key thing. The masseter actually has two parts, the superficial part and the deep part. The superficial masseter begins at the front edge of the cheekbone. You can easily locate the front of the muscle belly by clenching your teeth together and placing your finger just below the center line of your eye, and then you will going to slowly move outwards. When you clench your teeth together, you will going to feel the muscle activation under your fingers. From there, the muscle rounds downwards and slightly backwards towards the lower jaw. If you move your fingers along the lower edge of the jaw while clenching your teeth, you will going to clearly feel where the muscle becomes active. This muscle feels the angle of the jaw very strongly, and as you can see in this image, it attaches over the fairly large surface area. To locate the deep part of the masseter, open your mouth slightly. Then move your fingers downwards just in front of your ear. The deeper muscle runs underneath the cheekbone and slightly forward, finding the painful spots. Now, when we know where the muscle runs, we need that very gentle pressure. Place your fingertip flat, almost like a small plate, and rest your elbow to the table. When you systematically examine the muscle on the painful side, allow the weight of the head about 8% of the body weight and press lightly through your fingers. Move slowly downwards along the entire muscle. If you find spot what produces your familiar symptoms, whether it's tooth pain, headache, ear symptoms or something else, that's actually a great sign. It means that you have located the structures involved to your pain. And if your familiar symptoms increases slightly when you press that spot, that is a good news. The hardest part of this process is now done. Now, we just need to calm the irritated structures. What does the Botox do? Botox can reduce the pain of some individuals because it's reducing the muscle's activity. The effect usually begins within 1 to 2 weeks from the injection and it can last 3 to 4 months. However, the Botox doesn't remove the underlying stress factors that may be causing the problem. It can also sometimes affect the facial expressions or the way the bite feels. How to stretch the masseter properly? If you simply try to open your mouth very wide, it's actually quite difficult to create effective stretch. Better strategy is to limit the movement of the muscle first and then open the mouth. So place your fingers flat over the muscle and gently push the tissue upwards. While maintaining the pressure, now slowly open your mouth. This creates very effective local stretch to the masseter area. You can also do this one side only. Place your fingers to the right side, for example, and open the mouth while restricting that muscle. If your hands have arthritis or simply get tired during this, you can also replace the finger pressure with this small massage tool. You can find the link in the description. Place the flat edge of this tool against your muscle, lift it about 45 degrees upwards and then open up your mouth. You can do this on the both sides or one side only. To stretch the deep part of the masseter in front of the ear, the pointed edge of this tool works very well. Place the gentle pressure in the front of the ear, angled upwards slightly, and then open your mouth slowly. How often should you stretch? I recommend treating the most sensitive areas once or twice per day, but your facial muscles should be always remain relaxed. If the stretching becomes painful, the body will reflexively tense against it and then the stretching becomes useless. Start gently and progress slowly. Should you use the cold or the heat? If there is an inflammatory pain, the pain often feels this kind of throbbing sensations, tender, and sometimes the area might be warm or red. If anti-inflammatory medication reduces the pain significantly, cooling may help. You can apply the cold pack wrapped in the damp towel. Wait until the sensations go away and then take the package away. If the muscles feels instead extremely tired or overworked, the heat may be more helpful. Heat causes the blood vessels to expand, increasing the oxygen-rich blood flow to the tissues. This can help relieve this kind of ischemic muscle pain. How to massage masseter muscles externally? Let's use this right side as an example. If your symptoms radiate towards the ear, it's really important to examine the posterior part of the masseter. Move your fingers downwards along the jaw and identify the most tender spots. If pressing one of those spots reproduces your familiar symptoms, that is the area what needs to be treated. If your symptoms radiate towards the forehead instead, the front position of the muscle should be examined really carefully. The more you explore on these areas with your fingers, the better you will going to understand where your symptoms originates. Once you will going to find a painful point, you can hook your thumb and support it with your index finger. You can use either the sharper edge of the thumb or the broader surface. Rest your elbow onto the table and apply gently pressure using the weight of your head. Play a good song on the background and treat the area for the duration of the one song. Keep your jaw relaxed, teeth apart and facial muscle calm during the treatment. You can also use this massage tool. Choose appropriate tip, apply the gentle pressure and make slow circular movements. You will get to find the link to the tool below. If you feel these strange symptoms in the ear area, here is a helpful tip. Pull the ear straight back once horizontally with the hand of the same size. Then massage gently in front of the ear with your fingertips. You can also experiment with slightly different angles. Upwards, horizontal and slightly downwards. Some people even can combine the ear movement and the massage. It will going to be tricky. Easy to do with the females than males. And if the ear symptoms begin to calm down, you probably found a helpful technique. Treating the muscle from inside of your mouth. You can also treat the muscle belly from inside of your mouth internally. Use the opposite hand. Wear a glove or make sure that your hands are really clean. So soap them up good and wash those. Slide your thumb along the teeth towards the molars. You can gently clench your teeth occasionally to feel the muscle belly and where it's located. Once you feel the muscle tension against your thumb, you're at the right place. Then you can push the muscle away from the teeth while your thumb is creating localized stretch. You can also make small circular movements to relax the muscle from inside of the mouth. Important things to remember during the treatment. Sometimes the symptoms may briefly flare up when you are treating those trigger points, but wait for a bit in there. If the pain doesn't calm down, reduce the pressure. Small, temporary increase in symptoms is quite normal and it usually settles down within 1 minute. If you treat the sensitive area once per day for a duration of one single song, you are doing it very well. What kind of stuff can be used for the massage also? You can attach the wine cork to an electric toothbrush to make simple vibrating massage tool. Or if you want something more powerful, certain vibrating device can also work for the massage. Lacrosse ball is also excellent option, especially if you want to spare your hands. You can even use it while lying on your side. The most important principle. The most important step is to identify which specific structures reproduce your typical symptoms. Once you target those areas, you don't usually need to do that much of the treatment and you will going to get good result. Most of the jaw problems are actually muscle related, which is a good news. Muscles are usually easier to calm down. When the body is relaxed, the nervous system sends fewer activation signals to your chewing muscles. And if the overall symptoms remain way much easier to manage, then it's going to good direction. Breathing exercises can also help if the nervous system is running too high stress state. If your symptoms suddenly worsen without clear reason, or if the self-care doesn't any longer help, it's time to consult a professional. If you are interested in improving your health and well-being, I put together a great playlist here. If you want simple instructions for kinesio taping for the masseter muscle, check out this video.